Today's lecture is the lab 13 of the practical anatomy. Today we will have the nasal cavity. First of all, I'm gonna name the structures here. This is the nasal cavity. This is the external nose, which is cartilaginous part. This is cartilage. And this is the internal nose. And these are the nostrils, which are the nasal openings from here. And also here we have the nasopharynx, which extend from the beginning of the soft palate to the end of the soft palate. So all that is a nasopharynx. Here we have the oral cavity. This is the oral cavity, and it ends by the end of the soft palate. And we have also the oropharynx, which starts from the end of the soft palate to the epiglottis until here. This is the oropharynx. And the continuation of that, here is the larynx, and here is the trachea, and here is the esophagus. We will start by the nasal cavity. First of all, the function of the nasal cavity is to humidify and warm the air, trapping the particles, and of course the smell, the function of the nose. The nasal openings will be separated by a septum. This is the nasal septum. And the nasal septum is thin mucosa, which is rich in blood supplies. And usually the nasal septum does not separate the nostrils into asymmetrical openings. Usually it's unsymmetry. And the function of the nasal septum is to increase the surface area. Now we are gonna discuss the borders of the nasal cavity. This is the nasal cavity, the borders of it. First of all, the first part is a cartilage. The second part is the nasal bone. Here is the nasal bone until here, until that portion, that line. This is the nasal bone. This is the frontal bone, and here is the ethmoid bone. Specifically, the cribriform plate of the ethmoidal bone. Here we have the sphenoid bone, in addition to the maxillary bone until here. And here we have the palatine bone and hard palate, which is a part of the maxilla, and the palatine bone. Here we have the nasal septum. So the function of the hard palate is to separate the nasal cavity from the oral cavity. This is the septal of the nose, which is medial border of each nostril, and the lateral border of each nostril is the concas or conchas, the same. They are the same. As for the medial wall, which is the nasal septum, consists of the first anterior part, anterior 1/3, which is cartilaginous, posterior 2/3, which is bony. This bone is called as a perpendicular plate of ethmoid bone, part of the ethmoid. This is the cribriform of the ethmoid bone. This is the crista galli, and it continues to form a perpendicular plate. And here is the vomer bone, as we have discussed in previous lectures, which is a triangular shaped bone, and it appears from the posterior side, from the nasal posterior openings. And here, that very small part of bone, which is the nasal crest of the maxillary bone. And this is the nasal crest of the palatine bone. All these are connected together to make the septum that separates the two nasal openings, two nasal cavities. And it also has a mucosa covering it, rich of the blood supply, and that's why we see a lot of cases in a bleeding in the nose, especially from the anterior part, epistaxis. So the blood comes from the capillaries, because the capillaries here is very thin and superficial and rich capillaries.